Good evening, Pauline from Mississippi. Happy to see you here. I think we should be live about now. Starling, are we at the countdown phase yet?
1 second. Sorry, I'm having to relog into your Facebook, Topeka. Give me 1 second.
No problem. Hi, Sharon. Good to see you. Thank you for joining. Hi, Tabitha. Thank you for joining. See, we have Georgia in the house. Absolutely. Thank you, Sharon. I'm going to go ahead and get started. And then when we come over to Facebook, then we can just add everyone on there. Hi, Vanessa. Good to see you. Thank you so much for joining. But thank you and good evening, everyone. We're super excited to have this conversation around improving maternal health outcomes and building pathways to economic security. My name is Topeka K. Sam, and I'm the founder and executive director of the Ladies of Hope Ministries. And our vision is epic. We're working to end poverty and incarceration of women and girls. And as we know, the number of women going into prisons, they are, exponentially higher at a rate than of men, as are in the United States, the highest maternal morbidity rate is in the US of any or all developed countries. And so what we're talking about today right now around women and the maternal morbidity and maternal mortality is that the Center for Disease Control and Prevention, Black women are 3 times more likely than white women to die during childbirth or due to childbirth-related causes, with 60% of these deaths classified as preventable. Additionally, research shows that when a pregnant individual or their partner is incarcerated in the year before birth, they are more likely to have inadequate prenatal care that can lead to low birth weight and preterm birth, as well as infant mortality. And we don't even think about women when they're pregnant in prison. I mean, from the work that we have done around the country with the dignity legislation, passing 15 pieces of legislation to date, and still there are women who are being shackled during child labor while they are presently incarcerated. And so what LOHM has decided to do to address the maternal health crisis, we launched a Doula initiative with Optum support. We also teamed up with Mama Glow to train 50 women and non-binary individuals who are impacted by the criminal legal system to become birth workers and have their own birth workers business. Today, we're gathered to discuss the Doula initiative, learn about birthing conditions behind bars, and discover how lawyers, companies, and birth workers can unite to improve maternal health outcomes. Our guest panelists are Callie Chamberlain. She's a leader or co-lead of the Optum Social Responsibility Program. She's responsible for advancing health equity and revolutionizing health across their patient population. Callie sits on several boards, including LOHM, co-hosts one of Apple's top 5 medical podcasts, Until It's Fixed, and is a Reiki practitioner, birth and death doula. Thank you for being here, Callie. Nichka Granger is a member of the LOHM's Faces of Women in Prison 2021 cohort. She has been a public sector professional for over a decade. She's impacted by the criminal legal system, and because of her traumatic lived experience, she has a passion for researching the criminal legal system in the United States and advocating for change. She is currently pursuing an executive master's of public administration with a concentration in public policy. And the Latham Thomas, who is the founder of Mama Glow, a global maternal health and education brand serving birthing people along the childbearing continuum. Latham is a fierce advocate for birth equity and works to bridge policy gaps in maternal health. She's co-founder of the Continuum Conference, a gathering centering the experience of fertility, pregnancy, and new motherhood, and the Mama Glow Foundation, advancing reproductive justice through education, advocacy, and the arts. And Amy Fettig is the executive director of the Sentencing Project. Amy is also a human rights lawyer and leading expert on criminal justice reform, and also garnered national recognition for her work on prison conditions. Prior to joining the Sentencing Project, Amy served as deputy director for the ACLU's National Prison Project. Thank you all for joining, sisters. I appreciate you being here, taking out your time this evening, and bringing your expertise to the table to share with our community about what's happening in this country for birthing people, specifically of color, and those who are incarcerated. And so we'll just start the conversation. I'm going to start with Nitchka. Nitchka, can you please share as much as you'd like of what it was like being pregnant and giving birth while incarcerated?
Certainly. I'd like to start by stating that I served 6.5 years on an 8-year deferred adjudicated probation sentence. The probation was revoked due to falling behind in payment of fees. On August 31st, 2001, I was sentenced to 2 years to the Texas Department of Criminal Justice. I was 7 months pregnant with my son Elijah. I was shackled and transported to Tarrant County Jail and placed on suicide watch in a cold cage, naked, under a padded so called safety smock. It was extremely weighty on me, especially on my pregnant belly. I remained in Tarrant County Jail through the 9/11 collapse of the World Trade Center, eating jail food menu of bologna and bread until October 15, 2001. I was then transported, shackled, just 11 days prior to going into labor to the TDCJ Maximum Security Prison in Huntsville, Texas, for approximately 3 days. I was then transported again in shackles to a minimum security prison in Texas City, Texas. On the labor and delivery side, on October 6, 2001, I was transported again in shackles, ankles, both wrists, and belly while writhing in labor pain to the Texas Department of Criminal Justice Hospital in Galveston, Texas, the UTMB Health, the University of Texas Medical Branch. I pleaded with the EMT to please remove the shackles to no avail. I delivered my son while shackled to the birthing bed with a female correctional officer holding my hand, the hand that was handcuffed to the bed, and crying with me. Upon the delivery of my son, they placed him in one unshackled arm while the other remained shackled with Demerol while Demerol was administered without warning me. I'm begging someone, please get my baby. My body was shaking uncontrollably before the Demerol was administered. My body begins to relax to the point that I'm afraid I may drop my baby as my body is going limp. I came to, still shackled to the birthing bed in a hallway with an officer standing by. I was then taken to the hospital room where I was locked inside. I asked to see my son. I was told I was told you will as soon as allowed. I did not bond with my newborn infant son on that day. The next day, I asked to see my child. I was told that I would see my child. However, I was taken to see the doctor for a checkup, as they termed it. During this so called checkup, I'm shackled with an officer nearby, a female officer, correctional officer. The doctor was, in fact, performing a non surgical sterilization whereby he inserted a metal object in my vagina and cervix, which caused such an excruciating, intense burning inside me that I yelled at him and I asked him, "What the hell are you doing to me?" He answered, "We're just checking on things here." What this non surgical sterilization process does is create scar tissue to form and blocks the fallopian tubes. I gave absolutely no consent whatsoever to this brutal attack again on my person. I'm brought back to the holding hospital room. I asked again to please see my baby. This is my second day of begging to see and bond with my son. Didn't happen. On the third day, I'm told that my sibling and my daughter Starling are coming to get Elijah. That's my baby behind me. And they said to me that I would be able to see my child before he leaves with my family. They take me to be with my newborn son and tell me that I have 15 minutes. When the 15 minutes is up, the officer had to pry, literally peel my each finger from both my hands away from my baby to take him from me. I'm sent back to maximum security and placed in solitary confinement. I don't remember how long, but that was miserable and debilitating as well.
Thank you so much for sharing. I know we talked a little bit about before you even got on here, you holding your composure, and I'm just a mess because I felt every bit of your pain just now, not having lived that experience, but I could feel your trauma even now. And I'm so sorry that you had to go through that and experience that. And I'm grateful that you're here because that what they have done to you could have killed you. And I'm just happy that you're here and able to share and just, it's just terrible. Whew. Thank you so much, Nitchka, for sharing that. And people really, really just need to hear and understand and ground that just because you're incarcerated does not mean that you should be treated less than humane. For any woman to go through that while giving birth, which is deemed one of the most beautiful experiences that any woman or birthing person can go through, and have that stripped away because you were already incarcerated is there's no words for that. And so thank you so much. And I'm going to shift just for a second because I know I want to give you a second also to just breathe. I'm going to go to Amy for a minute. Amy, when you worked for the ACLU, you litigated federal class action prison condition cases under the 8th Amendment that address medical and mental health care in prison, solitary confinement, and sexual assault. You are also a leading member of a national coalition to end the practice of shackling incarcerated women. Can you tell us more about the conditions of confinement and protocols for birthing people when you were fighting to change, and what were the outcomes of your efforts?
Yes, and thank you for inviting me here to speak with everyone today, Topeka and Nitchka. When I hear your story, I mean, it's wrenching, but I want everybody on this call to know that Nitchka's experience as a pregnant person in jail and prison in this country is not an outlier. It is a horrific story, but that story of being shackled, of being degraded, of having your health compromised, having the health of your child compromised, it plays itself out in nearly every pregnancy that we see. And we have to work together to stop it because it is all too common in this country. And I mean, we are in the 21st century. It is 2021. And when Nitchka is telling her story, I am thinking back to our sisters who were enslaved over 100 years ago, over 150 years ago. And the treatment they were subjected to, is it so different than what we heard Nitchka talk to us about today? Unforgivable, inexcusable. So I think the first question we always need to ask is, why are there any pregnant people in prison, jail, and youth facilities or immigration detention facilities in this country at all? They should not be there, period. There is really no security reason to keep pregnant people behind bars in this country, especially when we know the degradation that happens. The stories of poor pre and postnatal care, the shackling that is still all too common in this country today. Both women, when a woman or pregnant person is found to be pregnant, all the way through the birthing process to postpartum, when we know actually there's a huge risk of shackling somebody postpartum because it creates more blood clots, which is a very huge risk for women who are pregnant. So we find that a lot. Lack of actual decent pregnancy care. And I want everybody to know and to have this context that in this country, under the Constitution, the 8th Amendment, people who are incarcerated have a right to medical care. It's already in our law. And that medical care under our case law is supposed to be the community standard of care. So we have to ask ourselves, was the care that Nitchka got the community standard of care? By no means was it. So we have these laws in place, but they don't get enforced because, frankly, over and over again, pregnant people, women and girls in the criminal justice system are absolutely ignored. These systems act as if they're surprised that they're there, and they do not serve their unique needs. I mean, it can be no surprise to anyone that someone entering prison might be pregnant or jail, that is a condition that requires special care. And yet too often these systems, we found, had very few standards or guidelines to provide decent care. They had very little access to gynecologists or obstetricians in any way. And so the care that was provided was always poor. But going back to Nitchka's experience, what did we also see very, very commonly? Pregnant people are placed in solitary confinement, allegedly sometimes for protection. And then after they have given birth, when they come back and they've just had their children ripped from their breasts, and they're put in solitary confinement, where we know that the likelihood of suicide increases enormously. Is there any excuse for this? What we also found is that when pregnant women are returned to incarceration settings, well, is it any surprise that pregnant people actually express milk, but no provision is made in order to lactate? And so oftentimes we see grave infections and mastitis and unnecessary pain when all you really have to do is provide a breast pump. It's actually not that hard. And also, going back to Nitchka's experience, very common. People give birth, they're returned almost immediately to an incarceration setting, and there's no provision made for bonding with their babies. There's no provision made for decent visitation with their babies. There's no provision made to provide milk for their babies. The system totally ignores these unique but totally predictable needs of pregnant people and people who have recently given birth. We need to change that. And I don't want to sound like there's no hope and it's absolutely awful. The situation is bad, and we should all be accountable for what happens behind bars. But recently, like at LOHM, activists, especially directly impacted people, have organized to pass legislation to ensure that women and pregnant people are not shackled during childbirth, prior to childbirth, postpartum. It varies by jurisdiction how good these laws are. And I will say that there have been difficulties enforcing them because the laws get passed and then jailers don't follow the law. Shocking, law enforcement doesn't follow the law. So they have to be held accountable by the communities. And in fact, we've seen activists go back and pass another, even stricter laws. Similarly, there have been laws and efforts to ensure that pregnant people are never placed in solitary confinement, but that needs to be across the country, not piecemeal based on one or two successful lawsuits. We also need better pregnancy care standards. There's almost no actual law, legally binding standards for pregnancy care in this country. The state of Maryland, because formerly incarcerated people came home, they knew the horrible experience they had, they acted together to get state laws passed to mandate certain standards for pregnancy care throughout that state, but Maryland is a rare example. We need that in every state in the country. And we also need these prisons and jails and detention centers to report on the pregnant people. Right now, there's no data. They don't have to collect any data. So they can hide behind, no pregnancy outcomes. We don't even know how many people come in pregnant. We have some estimates, but it's not universal. So all in all, what we really especially need is more attention paid to pregnancy care for justice-involved people, more efforts to make sure justice-involved people who are pregnant don't go to prison, jail, or juvenile detention centers, and better and stronger laws and enforcement and oversight for these institutions.
Thank you so much, Amy. Your first statement when you need to be incarcerated in the first place, that summed it up for me. But to your point, all of the legislation that has passed, and even in Florida, the sisters down there, the Dignity Coalition in Florida, passed 2 pieces of legislation around shackling, anti-shackling, and also pregnancy, women who are pregnant incarcerated. And it's still, the reason why the second piece of legislation had to be passed was because there was no oversight on the first, which is why, part of the work that we're doing with the EPIC ambassadors work is creating an oversight committee that is led by and of impacted women so that we can go into prison and jails, just like the Corrections Association does in New York. At any time, so that we can actually have access to our sisters and get them the things that they need and make sure that that's happening. But I believe even with the legislation that has been passed and we were able to get the provisions put in first act, there's 23 states that still allow shackling and putting women in solitary confinement in prisons and jails in this country. And so just to give everyone context, and I see many, many people who've tuned in, Tina Reynolds, who's been doing this work for decades and leading a lot of these efforts, are on here and know about the work that has happened, it is happening and needs to continue to happen. And with that, I'm going to go to Latham. Latham, for viewers who don't know, can you please explain what a birth worker is? And how did you decide to get into this work and to address the maternal health crisis?
Thank you, Topeka, and the LOHM family for organizing this gathering and holding space for us this evening. I just want to first acknowledge Nitchka and your vulnerability and your story, lifting you in this moment, because every time we have to share something that is deeply wounding, where we were not seen in our humanity, it takes energy to do that. And we know that for the purposes of bringing not just the storytelling to the forefront, but the visceral connection to what is actually happening in spaces that we don't get to record, that we don't get to see, that aren't at the front of our news feeds or in our newspapers. And because of the way that our system sees people who are invisibilized because they're behind bars, there's also this negligence that shows up cross culturally, right? And so thank you for bringing your story and sharing with us and being so somebody put brave, just to actually be in this space to share. So thank you. And I was listening, a couple things that also Amy pointed out that came up for me is, family separation is a very American thing, right? It's been happening since the inception of this country. through Indigenous people, with Black bodies, Black folks who were forcibly brought upon these shores, separated before they even left by men to women so that they couldn't have protection, and fighting and knowing that they wouldn't be able to support the people who they were taken with, and came to these shores, and then were still separated on auction blocks. And then you would have a baby and be forced to wet nurse the mistress's babies while yours went without food. And so our bodies, and this idea of bodily autonomy, is a new concept for people of color, specifically Black women. And our a sense of separation is so common in our families, right? And so to see that, the actual rudiments, to understand the rudiments of our criminal justice system stem directly from slavery. Our managerial systems for all corporations stem from slavery. Every sort of system that we have in place in this country is the rudiments are rooted in white supremacist patriarchy. And so for us to envision a future whereby people who are living incarcerated, people who are coming home, people who are living outside can have experiences of birthing and safety, dignity, sense of belonging, feeling seen and heard, having quality care. I heard something about community care, and it's actually not happening in our current medical model anyway, unless we're really centering the midwifery model of care. So we have systems that are failing everybody across the board. And because there's no accountability, right? It makes it even worse because we have no systems for actually holding people accountable for the harms they commit, for the injustices and the laws that they break to do so, right? And so I just wanted to offer that first because it's the framework through which we sort of look at how we approach the gaps, right? And so what doulas are doing and what birth work is about is really to not only educate and support and be a presence and make sure that folks have advocacy tools, but also to see and model what it looks like to have community care. And what that is village keeping, right? We evolved like this, especially folks of color. This is how we commune, right? Like we've band together, we support aunties, big mamas, everybody comes in. But look at how we've evolved. So a lot of us live far away from our family members, right? Especially in COVID, we saw how that affected many of us who were isolated. And so what that does is it leaves gaps where we don't have that familial support or that community network to show up at our times where we're most vulnerable. And birth is one of those times where we're vulnerable, right? And so what doulas can do, especially in modern times, is show up to be that presence of support, right? To fill some of those gaps, to help you create a birth village around you, right? Which it includes, your physician or midwife, includes a mental health provider, includes like a spiritual support, includes maybe healing arts, whatever it is that you use as part of what gets you through, right? So these are all things that like we show up to bring in terms of resource. But the other thing that we help to do is help people navigate a system and a terrain that they're not really familiar with, right? And so if you're having a baby at home, you have to understand what that entails and how you navigate that, right? What types of questions you would ask a midwife, how you would establish that type of care, who takes your insurance, what type of insurance, right? All those things. If you're having a baby in a hospital setting or in a home, in a birth center setting, it's making sure that you have the resources and the information also to navigate those settings as well. But understanding that we live in a country that has systematically undermined caregiving, right? This country, because it's not capitalist to care for people, right? And so caregiving has been undermined. So the work that birth workers do, the work that doulas do, the work that midwives do, does not uphold like our systems, right? It's actually anti-system. It's about support. It's about networks. It's about community, right? And so showing up in a space that's not designed for us, right? When we show up in spaces, at the very beginning, Topeka mentioned these statistics, right? She talked about how Black women are 3 to 4 times more likely than white women to die due to childbirth or due to childbirth related causes, right, in the US. And so this is the most dangerous place in the developed world to give birth, right? And by the way, the US is doing nothing about it, right? There's a global imperative, to shift the numbers, and every other country's on board except for the US, right? So we haven't made any steps forward. We're actually sliding backwards compared to other countries, right? Alarming. So when you see that, what that says is that what's more important is business, right? What's more than bodies, right? And so it means that also those that we can protect, we choose not to. Because if it were white women dying in this way, we would not be having a discussion like this. We would not be, why would we have a panel of it? Because there would be no panel, because it wouldn't be happening, right? So there's no value for Black and brown life in the same way, which is why we see these numbers. And it's not because of economics. Economics does not protect you. You could be Serena Williams and almost die in childbirth, right? So we know it's not economic. We know that it's not because of education. Black women are the most educated population in this entire country, right? We know that white women who have a high school degree, right, have a better chance of a better birth outcome than a Black woman with a postgraduate degree. Okay, so it's not education, right? It is the lived experience of racism. It is the chronic stress on a body that weathers you that forces that you are working against before you're even born, right? The force is working on Nitchka before her baby even arrives. That is the mechanism that is running this country and that really rules the world, right? And so when we're talking about these systems that we're seeking to dismantle, it's so much work. But what's really important is that there are people who are constantly working to chip away at them, while there's other people who are constantly working to build the future. And what we're doing, and what this work that Topeka is centering, and what we've decided to come to do together, is to try to focus on building the future, right? What can we do for people who are coming home? What we can do to send people back into spaces to help people that have the skill sets to navigate birth, regardless of where they're at, regardless of what the setting is. How can we make sure that there's economic supports and community supports in place? How can we make sure people have a living as a birth worker, right? In a country that undervalues work of the home and women's work, right? How do we center these things? So that's at the core of what we do at Mama Glow, is educate, empower, and impact. And then also to really see that we're aligned with the same values that LOHM has around ending generational poverty, right? We have to create our own. And so creating a coalition of birth workers, right, that can go back into their communities where they were outliers maybe, or where the system decided, like, guess what, because you came through the system, you don't have access to the same opportunities. All of those things now are forfeited because of structurally, right? Again, like slavery, right? You have the same, we're looking at the same types of, sets of setbacks, right? In 2021. So this kind of framing of what empowerment can look like in our communities, what solving for better birth can look like, creating support networks and systems within our own communities. That's how we build a future. And that's also how we create something that doesn't exist yet. And we all have to live into it, and we all have to support each other. And so I'm just thankful, Topeka, that we've come together to bring people to who really are committed to want to do this work, to be able to do this, not just for themselves and their families, but also for the future, also for the unborn.
Thank you so much, Latham. You are so powerful, and I am just humbled that you answered the call. It is what you take, and it is your approach to this work. And thank you, Callie, who I'm going to introduce soon, for stating that, hey, this is what you want to do. I think you need to talk to Latham and Mama Glow. Because every time you speak, it just gives me chills, because all of the history, you can show the intersections, you can show the why, and the why we need to do this community and opportunities for our community. And while we talk about these disparities that happen for women of color, we don't even ever think about women who are incarcerated, who are often poor, white, Black, Indigenous, who are often left alone, you know, whose family, because they've been incarcerated for so long, have passed away, or they're just non-existent. And when a woman goes in and she is pregnant, while we are training sisters both inside and outside to help her during her different stages of pregnancy, that is the community that she needs. And Nitchka, while you had a blessing even in that curse of having an officer who held your hand and cried with you because she was a woman and because she understood just how wrong that was. There is so often, on the other hand, where I hear the stories of sisters who talk about a male guard being the first face that their baby sees. So this is, I'm just overwhelmed with so much joy and so much emotion and so much pain. But this is why we do what we do, right? And Callie. So Callie, as I mentioned, you went through the training with Mama Glow. You are a certified birth and death doula. And what was that training experience like? And how have you been able to improve maternal health outcomes through your work as a doula and at Optum?
Yeah, hi everyone. Thank you so much for having me. I'm so honored to be here with all of you and just hearing you speak. Nitchka, just so moved by your testimony, and thank you for trusting us with your story. You are the reason why we do this work, and I'm just so grateful to be with you today. So what you just saw from Latham is like what I had a whole week of. It was the best thing ever. I learned so much. I learned so much about myself. I learned so much about the systems of health. I learned so much about reproductive justice and women's health and how all of these things are connected. And I really had the opportunity to reflect on how I could impact that system at the individual level as a birth worker, and also reflect on my role at Optum and how I could amplify that work at scale. So just to take a step back, Optum is one half of United Health Group. Their products and services, they own a number of clinics and hospitals. We actually are responsible for delivering 1 in 10 babies in the United States. And so if you think about all of the statistics that have just been presented to us, and if you think about a system of systems and the way in which they have been set up that require a birth doula, require that kind of advocacy and support because our systems are inherently not listening to birthing people, you see the opportunity that Optum has to step in and say, wait a minute, not only can we impact this with our influence and our brand, but also we can think about the way that we deliver clinical care across our own clinics. And we can start to think about how we do business differently, how we start to center equity, how we start to design with and for our most vulnerable populations, and really start to think about how we impact and revolutionize this space. And so with that being said, the training that I went through with Mama Glow really catalyzed me to be able to put together a strategy, present that to our Optum board, and get that approved to be the signature issue across all of Optum. And with that, we had the opportunity to connect with a number of incredible organizations like the Ladies of Hope Ministry to be able to say, how do we show up authentically, lead from behind, and empower the people who are closest to the solutions to be able to also solve these problems with our resources and support as a Fortune 7 organization. And so I'm really honored to be able to lead that work. I mean, we have so much to do, not just out in the field, but also within our own organization. And we are really listening and trying to be led by the people that we're working with that come from communities of color that are directly impacted by all of these experiences. And so the last thing that I'll say is just that we're also funding a lot of different kinds of research that we know will impact the way that clinical care takes place in the field. We're looking at how we can support people who are pregnant and experiencing domestic violence, people who are incarcerated, like with the Ladies of Hope and the partnership with Mama Glow, and doing a number of other types of interventions that also work at the legislative and policy level, because we know that, of course, those are so fundamental to how we think about our society and the way that things happen. So I'm just grateful to be in this space. I'm so grateful to be a student of, you know, all the work that's taking place and all of the amazing Black, Indigenous people that I work with who lead a lot of this and really define where we need to be going, and then think about how I can leverage my position to be able to make sure that we do that as best as we can. And that's something I would encourage everyone in the audience to think about is, you have power, you have influence, whether you're a birth worker or you're someone else in the space. How are you centering your position to be able to drive equity? It will literally require all of us, because the system is so broken and the problems are so complex. And so being able to have these uncommon partnerships, being able to think differently about what's possible, right? The existing bar is not good for any of us. It's especially bad for Black, Indigenous, women of color, but truly it's not working for anybody, right? So all of this needs to change. And like Latham said, I view my role as sort of, I'm trying to change what exists. Other people are leading us into the future. Think about where you fit into that and how you leverage your influence and power to be able to help us get there. So thank you again for having me, and I'll turn it back to you, Topeka.
Thank you so much, Callie. And this is like, my heart, again, it's so full because I'm just like listening to everything. And as this being our newest program that we're launching, it's like, wow, we have wanted to do, I think 40, what we said we were going to do, we're doing 50 in our first cohort, have over 100 applicants of people who want to do this. And that's not including sisters who are incarcerated. Several, different Department of Corrections, when hearing the work that we do. I mean, I've even had commissioners reach out to me on LinkedIn, like, how can we bring this program into our prison? So it's like great that they are understanding, to your point, Callie, that we are closest to the solution, right? And that we know what's necessary. And when you have experts in their field come together, like LOHM, like Latham and Mama Glow, like Callie, like Amy at Sentencing Project, all of us bring something so unique. And Nitchka, like, you are just the root of the why we do all of this work. And so it's just incredible. I'm excited to just move forward in the future to not only change, what's happening in the system, but also in community. And so when we think about some of the policies, some of the policies we talked about that was passed around dignity. But Nitchka, what other policies or recommendations do you think that should happen as it relates to women who are incarcerated? We know they should not be at all. Let's start there. But outside of that, if a woman is incarcerated, and while we work on changing conditions of confinement and also decarcerating, what are some of your suggestions on what we can do and where we can start?
Topeka, in answering your question as to what is like and what can change. This is, we all know, an inhumane setup. It's a system. It was a horrifically traumatizing hell, and that's like that for all pregnant women, all girls and women who are incarcerated in the system. We were viewing Belly of the Beast. That triggered so much in me to see that young lady go through such hell while she was incarcerated. And what I think are the main injustices related to incarcerated birthing people to be urgently addressed are the shackling, the non-consensual sterilizations, the solitary confinement, and what Mama Glow is offering, the doula. I think that would be awesome. The woman, the correctional officer, she was crying with me, holding my shackled hand. She has compassion. So that's a compassionate place to bring to mothers in this predicament. I understand also the bonding. Now, I understand that the Texas City Prison Facility now have what they term a Love Me Tender Baby bonding program. I think that should be a major factor as well. A bill, HB number 1770, was introduced in 2007 by State Representative Rick Noriega of Houston, which, if passed, would provide housing for infants up to 1 year old. The bill is still in stage one of the 7 stages to become a law. So the bonding, all of it, everything that pertains to uh, birthing healthy children. I think that there's some emptiness I sense within my baby. Okay, in the first 2 months of a child's development, that is a very important time. So I think all of these problems being addressed and solved, I think would help this a whole lot, and having policies in place to address it. And that's why I'm returning to school, to get on board and really just push everything that needs to go forward as best I can, and my contribution to it. So I'm empowered. And Topeka, I thank you for Faces of Women in Prison. I thank God for you and what you're doing, because my PTSD level has gone down some with being able to bring voice to what I have internalized for what, almost 30 years? Not I've been in psychiatric hospitals, psychologists. I have not addressed this. So that was something that was so I couldn't bring it to the forefront. But I thank God for what you're doing with the Face of Women in Prison, the cohort with Inspired Change. Trish is awesome in all of the program that she's bringing. So with what you're doing, and I'm going to go learn how to write policy briefings, and I'm going to get in the root of it, and like you said, get into the root of who I am and bring power to this, and hopefully and prayerfully it'll change.
Well, thank you. That was powerful. You're already doing it. You probably have written a policy right now. Everything you said. So, we do this work because, we've lived this experience. And whether or not, like I said, I've actually was not shackled during child labor. I was shackled when they were going to remove my fibroids, which was as if I was 6 months pregnant. And that was a whole experience in and of itself. But when we talk about understanding, when you see and hear and feel what another sister is going through, and if we are sensitive to the spirit, we automatically want to do something to change that. And so whether it is empowering women to use their voice in order to change policy, to get paid as public speakers. And I love what Latham is doing around making sure that sisters are able to create their own business, right? Like, we are looking at ways to create equitable opportunities for women and girls, so that we don't have to be in prison to begin with, right? And then when we release sisters from prison, they can stay out of prison. And so the only way to do that is to provide, the tools and resources that people need in order to change their lives. So I'm going to go to Q&A. We've had such a big conversation, and I know we don't have that much time left. But I see a question from Tina Reynolds. We also need to include the voices of women who use substances, and how the stigma of self-selecting to use substances and the myth of the impacts on the fetus, and the inhumane treatment and judgment people met out to people who use these substances. So that was more of a statement, and absolutely right, Tina, which is why I'm happy that Tina will be in our first cohort, because we'll be learning a lot from Tina Reynolds and all of the great things that she has brought to the forefront in this work, and ways for us to think about, sisters and what their different struggles are, like substance misuse, or being affected by domestic violence, sexual violence, and how being pregnant and how all of that correlates together. So I'm excited to hear some of the feedback, and also suggestions that we have that can also help us to move the work more. I don't know if anyone else has any comments on what Tina brought up around women who use substances.
I would just like to add, yes, absolutely, Tina, because her comment really mirrors my experience with both clients who are women and girls in detention, where judges would decide that they would actually send a woman or a girl to jail or juvenile detention because she was pregnant, under the theory that, well, they need protection. Can't imagine a worse way of protecting someone than sending them to jail or juvenile detention. I mean, I had a client who's a young girl who had been raped by a family friend, and she became pregnant. She ran away from home as a result. And what did the system do when she was caught by the police? Instead of, either returning her home or putting her in a safe space in a foster home or with kinship care, they put her in jail. And she was rightfully outraged and angry every single day because she thought, well, why should I be in jail? I have done nothing wrong. But in the judge's eyes, and these are very uneducated people, the judge, a white man, decided that he was protecting her. And he thought he was doing a good thing. So we need to educate a whole bunch of folks who hold power right now that their instincts are wrong. And they're actually causing harm.
That's right. Thank you, Amy. Thank you for that. There's also a question that says, and this is to anyone, what are some tips for how to be a trauma-informed doula? I think, Latham, you can talk about that. And what is important to be mindful of when working with birthing people impacted by the criminal legal system?
Hi, thank you for the question. So trauma-informed doula support really should be the baseline for any type of support. So, there's a lot of programs that do not center lived experience. And so you'll have people who get in situations where emotions come up to the surface and our hormones are governed by our emotions. And so if we feel fear, then we're moving in a different direction than we probably want our birth to head into. And if you don't have somebody there who's not only like equipped enough to support you in that moment, who has the foresight to think about the experiences that you've lived through and how that may impact your birth experience, as well as your postpartum experience, as well as your life. If nobody's thinking about that and centering that in the first conversations you're having, then a lot of things happen that could have been prevented or could have been met with better intervention, right? So trauma-informed work is really about centering people's experiences, finding ways to create safe space to talk to folks about what they've endured, and understanding the underpinnings of emotion and how the nervous system works as well, so that you can navigate terrain that is really tumultuous in some ways and also really delicate. The things that we live through leave imprints on our bodies. A lot of the things that we're carrying are not even our own. A lot of us are carrying stuff from our mothers and our grandmothers and our great-great-grandmothers and beyond. And so even things that you haven't physically experienced yourself, you can have a reaction and a response to, right? And this happens for so many people. And then because of the medical model we have that does not really look at the body and the soul as being a connected thing, looking at science just of the body as a physical organism, but not understanding the multifacets of how we actually work in an integrated capacity, not having indigenous and ancestral traditions as part of that framework, leaves out in a contextualization that is really human, right? And so it's heart-centered work, right? It's human to human work. It is work that is about making sure that we repair rather than react, right? And so the framework is one of creating a foundation of safety first, right? Safety is the most important thing for any person, especially birthing people. If you do not feel safe, you cannot give birth. If you do not feel safe, you cannot give birth with dignity. If you do not feel safe, you have a completely different experience that takes place, right? And when you feel fear, it takes away your power. And so we're seeking for people to feel empowered in these processes, because how you give birth is how you live, right? And you have to do a lot of healing if you have an experience that was meant, that should have been, and it's your birthright for it to been safe and dignified and empowered. And if it went a different direction, people spend their entire lives in many cases trying to like unbind the trauma that's embedded in an experience like that, because it's a major life event, right? And so what the opportunity is that we have when we're supporting people from this framework is that even people who don't identify as having had traumatic experiences, or who don't really feel like they're carrying anything, those people are even better supported, right? So it's really about making the assumption that everybody is carrying something that's triggering, everybody is carrying something that's impacted them in a particular way, and being able to serve from that lens, right? So it is serving, the most marginal folks first, right? It is serving people who are impacted first, and using that as a framework, right? And it's always about restoring humanity. So that's how we can get people to come to a place where they're engaged with their healing, right? They have to feel seen first. And so your work as a doula and as a trauma-informed doula is to make people feel their basic human needs are met, to be seen, to be heard, and feel a sense of belonging.
Thank you so much, Latham. And there's two more comments, or one comment and one question. I'm going to go with the comment first. It's from Sharon Turner. Hi, Sharon from Georgia. So during my incarceration in the county jail awaiting to go to prison, I witnessed correctional officers mistreat and drag a pregnant woman, causing her to miscarry and placed in solitary confinement instead of taking her to the hospital. Is there a policy in place to make sure women who miscarry get proper care after losing their baby? I know that I can't say that there's a policy in place, and I don't know, Amy, if you or Latham, you know any. What I do know is that through the dignity legislation, and in Georgia, where Pamela Wynn actually works to get that legislation passed because of her miscarrying her baby, and being in solitary confinement, that they're no longer shackling, women during child labor and putting them in solitary confinement just because they're pregnant. But any type of mandatory policy in place, no, I don't know of any. I don't know if anyone else does.
There's definitely no national mandatory policy, and I'm actually not aware of any local level policy either. I mean, frankly, as I mentioned before, these institutions don't have to report birth outcomes. A doctor at Johns Hopkins University, Carolyn Suffren, did one of the first studies in 2019, right? And she got some voluntary data to find out what the birth outcomes in some of these states were, but that was the first of its kind. And we need more information, and we actually need all these institutions to have to report under the law so we can find out, what's happening, where there's a crisis, and intervene. It's really part of oversight and accountability that, as we've heard throughout the folks who've spoken today, it's just missing. And it continues to be missing. And as a result, people's lives are being lost, they're being damaged, and their human rights are being violated.
Absolutely. And, shout out to Carolyn Suffren. She's incredible. She's actually going to be working with us on creating some frameworks around just that, expounding on the work that she's already done. So she's, has done incredible data around that. We can also share some resources that she shared with us after the call as well, to those who actually signed up. Is from each person's perspective, what are the best uses for the women incarcerated to help? What are some best ways DOC staff, Department of Corrections staff, can help and get involved? So anyone, Nitchka, you want to start? How do you think Department of Corrections staff can get involved, and what is the best way that an incarcerated person can help?
I think the staff and the correction system need to be educated. There needs to be some type of educational presentation of what's happening that they witness and that they see. And just like the correctional officer who held my hand and crying, there are people who have compassion, but the system, these are their jobs. And sometimes they don't want to make waves, you know, but that is first and foremost, be educated. To have some type of compassion setting where within the penal system, in the prisons, where the inmates or yeah, the inmates can come with the correction officers and have some type of talk. We need to communicate with one another. We need to communicate and talk and share our stories and be educated by understanding each other and what we've endured and what we go through on both sides. On both sides. So I think those things would help.
Thank you. Thank you. Does anyone else want to add to that or have a final thought?
I would love to add something around just, you know, I love what you shared, Nitchka, and I think that languaging around what violence actually looks like and what it is and naming it, because when you hear her story, if that was in a setting where people were able to like hear in an educational setting, she used also the words penal system. It's punitive, right? And so the experience across the board is punitive. It is not life supported. It is not to make sure that you're thriving, while incarcerated. And so this idea that that we also have to bust up around like how to take care of people, how to put care into a system, especially for somebody who's being born into it. And so I think that if people understood really what is so critical to make sure that not just a physically healthy pregnancy takes place, but the essential emotional bonding that Mother Nature is so deeply invested in is not interrupted, to understand why movement during labor is critically important, to understand why having support and being witnessed during this time of great vulnerability is critical, to understand the science, but also the magic, right, in what birth really is. It's not a medical event, it's a spiritual one, and it's happening in a place where people need to provide safety and dignity, right? And so I think that if people really understood that it's not just giving somebody like a bed and hoping and some warm towels or something, but they understood that it's not the basics, it's really creating a safe space and a safety net. I think if we could get that right, there's a lot of things that we could change. And I think that this is a really wonderful entry point to start with, because it is the most vulnerable time in someone's life. And so getting folks on board, also from the perspective of a almost like having someone inside that serves as a proctor or prefect or someone who is invested in the program to like allow doulas to be in spaces to provide space for education, but also for that community building that's critically important as folks are going through this period in their life, is also something that we need to see, is folks who are vested in this type of future that decenters this type of power structure and recenters it within the community and the folks who are organizing and supporting themselves.
Thank you. Thank you. Callie, there was a question. I know we're a little over, but I just want to get the questions finished because everyone's so engaged. It was within our healthcare system, we see and experience great oppression within the system. What is being to change your power?
Yeah, it's a great question. I don't know if that cut out for other people, but I think the remainder of the question was about what's being done to change healthcare policy within the clinics. And so there are a couple of things that we're starting to work on. One is greater representation of Black, Indigenous, people of color that are actually in clinical leadership roles, that have C-suite level titles, have budget making decisions, and are able to recruit and retain professionals who have lived experiences and represent the communities that they serve. The other is to start thinking about social determinants of health and looking at the ways in which those directly impact our patients and seeing clinics as part of a community versus just serving a community. So that means that our staff need to be living in the environments and with the communities that they're serving, and being more holistic and thinking about what care looks like and what supports are available in the local area, so that if they have a patient that comes to see them and they're hearing about food insecurity, they're hearing about challenges with stable housing, they're able to connect to resources that are local, that are able to fill some of those gaps. The third thing is looking at training. I say that third because, as Angela Davis says, like, the future is not training. Like, that really is helpful, but not like the revolution. And that's right. But we are making strides toward making sure that our clinicians have experiences, exposure to different experiences, and are, being trained in how to provide culturally competent and sensitive care. The other thing that I would say is that, within the policy realm, we're also looking at things like provider burnout, which we know increases implicit bias, and looking at the expectations around administration and business that are placed on our providers, because they are providing care. And also, we are in a for-profit system, unfortunately, that requires our providers to use some of their time to do things like billing. And so how do we at Optum, going off of Latham's comment about the spiritual experience, right? Think about how we clear out some of that business and administrative process so that providers have the space and time to show up with their patient and be in relationship to them. So if we can think differently about how we set up their day and what their expectations are, I think we have a better chance at ensuring that at that policy level, right, providers have the space to interact with their patients differently. So I think all of those things are helpful. That's probably not what it's gonna holistically require to change, but I do think that those things can start to get the ball rolling, and we'll be able to learn from those interventions to understand what else needs to be done to make sure that those policy level changes are continuing to happen.
Thank you so much, Callie, for answering the final question. And I just want to leave everyone with these 3 points. Reproductive justice needs to be a top priority in the United States. We need to increase access to trusted healthcare professionals and inhumane treatment of birthing people, address the intersections of adoption, pregnancy, menstruation, family reunification, incarceration, and more. The maternal health crisis must be addressed. Birthing people, particularly BIPOC and incarcerated individuals, are not receiving proper care while pregnant and giving birth. We are hoping to change that. And steps to maternal health outcomes can be taken at all levels. Maternal health. Thank you all so much for joining this evening. Thank you, Amy, Nitchka, Latham, Callie, for your time, your expertise, your love. And we are super excited to continue to move forward and working together to have better health outcomes, health. Bye.